Hello and welcome. Today we'll be discussing a condition called ureterovesical chin obstruction, or UVJ obstruction. This is a blockage where the ureter, the tube carrying urine from the kidney, meets the bladder. We'll explore the causes, how it affects the body, the symptomagnosis, and treatment options available. Join us as we delve into understanding UVJ obstruction. What causes this obstruction? In many cases, UVJ obstruction is congenital, meaning it's present at birth. This might be due to a narrowed ureter, an abnormal valve-like structure, or an unusual positioning of the ureter. Acquired UVJ obstruction, while less common, can result from scarring due to kidney stones, previous surgeries, inflammation, or even tumors pressing on the ureterovesical junction. Understanding the underlying cause is crucial for effective treatment planning. Now let's look at how UVJ obstruction affects the body. When the flow of urine from the kidney to the bladder is blocked, urine backs up into the kidney. This backflow, known as hydronephrosis, causes the kidney to swell. Over time, this can lead to kidney damage, impaired kidney function, and in severe cases, even kidney failure. The increased pressure also makes the kidney more susceptible to infection. Determining the exact prevalence of UVJ obstruction is challenging, especially as mild cases may go undiagnosed. Congenital UVJ obstruction is estimated to occur in approximately 1 in 1,500 live births. It affects both males and females. Acquired UVJ obstruction is much harder to estimate and is related to the various underlying conditions that can cause it, such as the prevalence of kidney stones or the rates of certain abdominal surgeries. What are the signs and symptoms of UVJ obstruction? Symptoms can vary depending on the severity and age of the patient. In infants, it might present as frequent urinary tract infections, failure to thrive, or an abdominal mass. Older children and adults may experience flank pain, which is pain in the side of the body, recurrent urinary tract infections, blood in the urine, high blood pressure, or even kidney stones. Some individuals, especially with mild obstructions, may have no noticeable symptoms at all. How is UVJ obstruction diagnosed? A thorough medical history and physical exam are essential first steps. Imaging studies play a vital role in confirming the diagnosis. An ultrasound can detect hydronephrosis, the swelling of the kidney. Avoiding cystoscopy, or VCUG, can show reflux of urine back into the ureter. A diuretic renogram uses a radioactive tracer to evaluate kidney function and urine flow. And finally, a CT urogram MR urogram can provide detailed anatomical information of the ureter and surrounding structures. UVJ obstructions, based on their underlying cause and degree of blockage, aren't typically classified into distinct types. However, it's important to differentiate between congenital and acquired causes. Furthermore, the severity of hydronephrosis, graded from mild to severe, helps guide treatment decisions. Describing the exact location and nature of the obstruction also informs treatment choices. Treatment for UVJ obstruction aims to relieve the blockage, preserve kidney function, and prevent complications. Mild cases may only require observation and monitoring. More significant obstructions often require surgical intervention. Options include open surgery, laparoscopic surgery, or robotic-assisted surgery to reconstruct the ureterovesical junction. Another technique is endopulotomy, a minimally invasive procedure to widen the ureter. The specific approach depends on the cause and severity of the obstruction, as well as the patient's overall health. While congenital UVJ obstruction can't be prevented, minimizing the risk of acquired UVJ obstruction involves managing factors that can lead to it. Staying well hydrated to prevent kidney stones, promptly treating urinary tract infections, and carefully considering the risks and benefits of abdominal surgeries can all play a role. Early detection through regular checkups, particularly for individuals with a family history of kidney problems, is also important. The prognosis for UVJ obstruction is generally good, especially when diagnosed and treated early. Surgical correction is often successful in relieving the obstruction and preserving kidney function. However, long-term follow-up is necessary to monitor for recurrence or complications. Current research focuses on improving minimally invasive surgical techniques and developing new imaging modalities for earlier and more accurate diagnosis. Genetic studies are also underway to better understand the causes of congenital UVJ obstruction and potentially identify preventative measures in the future. Thank you for joining us on this informative journey through ureterovesical junction obstruction. We hope you found it helpful.